welcome tonight. I just want to take this opportunity, first of all, to welcome the Omeri Executive Directors, Dr. Odile Moloi, Dr. Makas Molokume, myself as well. I'm one of the directors. I'm the E in Omeri. And Dr. Rasati Tadi, also Dr. Isaac Sibuyi. Welcome, gentlemen, and thank you so much for being here tonight. And I also just want to take this opportunity to welcome all our members of the LOC under the leadership of Dr. Lamola, our HOD. Thank you, colleagues, for being here tonight. We welcome you. We also just want to welcome our Rally Digital under your stewardship, Tapang. Thank you so much for being here, Rally Digital, and for providing this, ambience for us all to enjoy this session tonight. And I also want to welcome all our Omeri 2026 speakers. Thank you so much for accepting the invite to speak at this conference. And I believe that we are going to learn a lot from you, and you're also going to learn a lot from us. And thank you so much for being here tonight. We welcome you. And we also just want to welcome all our DPA board members under the leadership of our Honorable Dr. Tabotwala. Thank you, colleagues, for being here tonight. And we also want to welcome all of our sponsors. I'm aware that tonight we've got sponsors, our exhibitors who came in and joined this live broadcast. Wherever you're watching us tonight, we welcome you and thank you so much for joining us tonight. And I will be doing a great mistake and injustice if I forget to welcome all of our local and international delegates. Colleagues, Omeri has got a footprint internationally. We've got supporters all over the continent, and also across the board, across overseas. So thank you, colleagues. Thank you so much, colleagues, for joining in, and we welcome you. Feel at home wherever you are tonight. Share the link and share the broadcast. Invite friends to join it. It's for free. And then sit back and relax. Wherever you are, sit back and relax and enjoy this broadcast. We welcome you, and thank you so much, our host, for giving us this opportunity. Back to you. We appreciate.
Thank you very much, Dr. Matlakala. It is now my honor to invite the head of the Omeri LOC, Dr. Khomotso Lamola, who will be unveiling the Omeri conference program. Dr. Lamola, the floor is yours.
Thank you. Thank you so much, and good evening to all our delegates and everyone that have joined us. And I am here to officially launch our Omeri 2026 program. So colleagues, if you think that Omeri 2026 is just another dental conference, then think again, because this program was designed for one purpose only, and that is to change the way you practice dentistry, and hence our theme, Switch for Change, the next level in dentistry. Now, this program doesn't only focus on one aspect of dentistry. It is very comprehensive, and it develops you, the clinician, so you become a holistic practitioner. Maybe Tsepang, what I can do as well is just to highlight some of the key topics that will be included in our program. And I mean, we're talking digital workflows from scanning to production. What is the latest technology? Are you updated? Do you still use the same method of taking impressions, or how do you do it in your practice? Then we also have modern endodontic techniques. We've got laser dentistry. I mean, Dr. Mabunda will be taking us through a journey of laser dentistry and how you can use it to become a part of, your treatment offerings to your patients. We also look at advanced radiology. I mean, gone are the days where we use the monologue x-rays. Now we're living in the times of AI. Is your radiology equipment adequate enough to compete against these AI technologies? And I will be giving a lecture as well on trauma management. I mean, you need to know, patient walks in with mom, child had trauma at school, bleeding, teeth are broken, what do? Are you going to sit there and be anxious and be scared? Or are you going to know what are the traumatology management protocols? And Prof. Mulder will also be taking us through the dentin replacement and all the protocols that are involved there. And one other thing that we thought was very relevant in our day-to-day as practicing as dentists is the medical legal compliance and the ethics part of what we do on a day-to-day. And we've got Prof. Motluba and Dr. Serapelo that will be taking us through that whole, giving us advice as to what is right, what is ethical, and what are the medical legal complications or challenges that we as practitioners can come across. And also we look at aesthetics. I mean, Dr. Vermaak will be talking clear aligners, and this is one of the practice builders. Are you going to incorporate it in your practice as one of the treatment offerings? So all in all, it's an all-in-one weekend. And not only that, we also have built-in exhibition time where our delegates will have time to engage with the different exhibitors and the sponsors to see also what is on the market, what are they offering, what is the latest technologies. And maybe we never know, there might be some, price negotiations going on there, but also there's an opportunity of networking as well as we'll be running draws throughout the whole weekend. So this is a full-on experience and not just a series of talks. And Tsapang, one other thing that I want to mention that is very, very crucial is that we have brought together clinicians who are actively practicing and implementing these techniques on a daily basis. So these are real clinicians sharing what works in the real practice and imparting that knowledge onto all of us so that we can run with the same systems when we go back to our practices. So lastly, I want to say this. If you're looking at this program right now that Dr. Eric is sharing, and you're thinking, I already know this, then you are exactly the person that needs to attend. Because as you may know, dentistry has moved very fast over the years, and there's a lot of technology, and we need to move up and update ourselves, and we need to run and move up with the times. So this is not just a program to attend point. This is a program you want to attend, you practice dentistry, and hence that's why we call it a getaway weekend, because you want changed and competitive dentists that can actually run with certain system and improve your practice. And so at this stage, I'd like to earn, if you contemplating somewhere in your mind to register, I think it's about time because time is running out. We've shared the registration links on all our social media platforms and our different WhatsApp groups. So please go in there and click to register because you won't be disappointed. This is a jam-packed program, if I can say so myself. And to all our delegates that have registered, thank you so much. You won't be disappointed and would like to see each and every one of you in Avianto on the 20th to the 21st of March. Thank you so much. Over to you.
Thank you very much, Dr. Lamula. Thank you very much, Dr. Lamola. That was amazing and beautifully executed. I believe this is such an amazing and exciting time in modern dentistry. So to further set the scene and to give us a visual preview of what to expect, we now would like to invite our technical team to a quick ad break, a little video. Please enjoy. Is everything all right, technical team?
You can continue just in the meantime. Yeah.
Okay. All right. Not a problem. I think we can add that towards the end as well, just to make sure that we stay on time. So the video, really shows how amazing the previous conference was, and it kind of gives you a feel of what to expect as well. So we are now just going to move straight into our interview segment, where we engage with two of our most esteemed Omeri Conference speakers and gain insight into their journeys, their perspective, and their contributions to the profession. So now it is my pleasure to welcome Dr. Isaac Sibuyi and Professor Rian Mulder. So I would just like to take a moment to properly introduce them and to kind of give you a background of who these amazing speakers are. I'm going to start with Dr. Isaac. Dr. Isaac is a registered dentist with health care provision, who is bringing 25 years of experience in private dental practice with expertise in endodontics, orthodontics, and cosmetic dentistry. And he has been the director of Dr. Sibuyi by Incorporated in Hazy View and recently White River, Mpumalanga, since 1999. That is a long time. And he serves as a key opinion leader for Wright Milner's 2018 to 2022. He also worked with Sci Vision Medical's 2025 and Oral Plus and Pandasgena 2025. In addition, he is a director of Omeri Holdings and has contributed to education as a sensational dentist at SMU, teaching endodontics both undergraduate and postgraduate students. From 2021 to 2023, Dr. Sibuyi holds a BDT since 1994 and BDS since 1999 from Medusa, and an MBA 2015 from Menkosa, and a certificate in implantology 2017 from the University of Pretoria. Dr. Sibuyi, I would like to welcome you this evening. I'll also just like to quickly move over to Professor Rian Mulder, who is a qualified dentist since 2007. In 2014, with an MSc cum laude in restorative dentistry, and holds a PhD in pediatric dentistry from 2019. Working both in pediatric and special needs private practice in Durbanville, and after 12 years full-time at the University of Western Cape, he has moved to part-time in the Department of Pediatric and Pediatric Dentistry. He has a good academic and clinical balance, previously training dentists in diploma courses in pediatric dentistry as well as aesthetic dentistry. He is a South African National Research Foundation rated researcher with over 55 dental publications nationally and internationally. Gentlemen, I'd like to take this moment to officially welcome you to the Omeri Live. Thank you so much for joining us this evening.
Thank you for welcoming us, and thank you for the introduction. Good evening to everybody. Yeah.
Awesome. Now let's get started. I'd like for us to, have a conversation. I think we don't want this live to be tense. We want to, exchange, thoughts and conversations. And I'd also like to invite the people that are watching to, participate in the live session as well by sending us messages in the webinar chat as well. So we look forward to engaging with you at a later stage. Now, Dr. Sibuyi, just, quickly tell us about yourself, where you grew up, what you do, and where you're practicing from.
Oh, yes. Thank you so much, Tsepan. Like she has said, my name is Isaac Sibuyi, and I was born in Akonuk, in the rural area of Akonuk, that is situated around Bushbuckridge in the Mpumalanga province of South Africa. I actually grew up in that rural area. Started my first 3 years of schooling. It was in a farm school. for those of you that knows where Bushbuckridge is, there's a place called Klaseri. It's in a farm there. That's where I started my first 3 years of schooling. And, I'd like to also say that as a young person or as a child, there is my aunt who always called me by this title that I'm called with, today. She always say, doctor, doctor. She used to call me Dr. Isaac from early childhood. So that actually motivated me to be where I am today. And I can openly, and I like saying this, that while I was at high school, there's a hospital just next to the high school, my former high school, where my mother went there for a tooth extraction. And those days, there was actually one dentist who will be training somebody to do tooth extractions, and sometimes he's not there. So unfortunately, my mother arrived there while this guy was working there, and she got her tooth extracted. From there it actually appeared to me, because once she extracted the tooth, we found her sleeping on the road where we were passing from school. And in that place where she was sleeping, we always saw, or we would always see, the snake track. Every time when we passed there, we always see. So when we found her there, we were surprised. I mean, that added to this thing that I must achieve myself. I must follow the health profession. I must be a doctor. So that added into that. And then it was at a later stage where I realized that the reason she was sleeping there is because she is hypertensive, and the guy that did the extraction didn't take the medical history, didn't even know how to take a medical history. So that was motivation enough to be where I am today. And but most of all, it is not because I could do it. It is because there was a force behind it that I should follow, dentistry. When I arrived at the medical school, because in the rural areas, sometimes the education is not as good as, in the cities. I was the best matriculant in our school, but I couldn't qualify to do dentistry. So I started somewhere else. Hence, I did dental therapy. But just to put, a spice on it, I did actually my first year, I did BSc diet, dietitian. I just wanted to be admitted at a tertiary institution. And second year, because I'm relying on my mother, so she couldn't afford, I looked for an easy way out. I went for BK. I'm talking about nursing. I went there. First week, I actually attended 5 days there, orientation, and I got paid. The money that I got paid with, I actually registered for dental therapy. So that was like, so just to cut a long story short, from dental therapy, I became the best dental therapist, final student. And I was actually the first student, or the first person to go to the dean and say, here are my results. I even have the SADA award. I have all these kind of awards for the best dental therapist. I want to be considered for BDS2 instead of, first year. That's how, in fact, I was the first to be taken into BDS2. So that's how I find myself where I am today. And looking forward to, we're still growing, we're still learning in dentistry. Thank you so much, Stefan.
All right. Thank you so much, Dr. Sibuyi. That was beautiful. It's very important to get to know the story behind the person, because a lot of people look at where you are now and think, it was all smooth sailing, and they do not understand that, every journey has its own ups and downs. But I love that your aunt also manifested that for you, and it also gave you purpose. The challenges that you experienced gave you purpose, and here we are today. Professor Rian Mulder, I would like for you to also tell me about yourself, where you grew up and what you do and where you are currently practicing.
Thank you very much, Sipang, and thank you for all the delegates joining us this evening at this Omeri broadcast, giving you a little bit of a taster of what's to come next month, actually the month after next. So my passion for dentistry has been since a very young age. I was fortunate to have a very, very good dentist that had an excellent bedside manner, and she really had a talent to treat pediatric patients. So even as a child, I was never scared going to the dentist purely just because she had this calming nature and she really knew how to make a child feel comfortable. So my dental experience has been really positive, and I think that's also where that has come for me, because I would also like to have become a dentist like that. And very interesting, in 2016, I gave a lecture in the Free State, which I grew up in Bloemfontein. And lo and behold, there in the crowd sits my old dentist. And then it just shows you how everything becomes full circle, where you as a child go to your dentist, they are the pinnacle for your treatment. And then many, many years later, she sits there to now try and learn something from me. So that was really fantastic. And we had such a wonderful time after the lecture and reminiscing on me as a child and now her as an older dentist. And she has in the interim retired. And that's really where my passion has originated from. And I use that to also hone my skills in order to be proficient as a pediatric dentist. I also practice in special needs dentistry in my private practice in Durbanville. And then I also see geriatric patients because there's a large population of geriatric patients and they really struggle with their false teeth and their dentures. So that is really where my practice is focused on those three items, and I really enjoy them very, very much. My other passion is research. So I do quite a lot of research, as you've seen from my publication list, and everything is open access and you're able to view it online. And dental materials is really my big passion in dental research. And if there's something new on the market, I just have to have it and I have to have a look at it and see how it compares to everything else that we are using, because we have to keep on moving forward. As technology improves, we have to relearn and reteach ourselves in order to always stay ahead of the curve.
Thank you so much, Prof. That was beautiful. From being just the little boy who had a dream to now being in the same room with the same dentist that used to take care of your smile. It is such an inspiration to be in this room right now. You cannot understand. So you are both going to be speakers in the upcoming, much anticipated Omeri Getaway Conference 2026. So, what can the delegates expect from this conference in general? Dr. Sibuyi, take us through it. What are we looking at? What's going on? What's the vibe?
Yeah, the vibe is based on what is it that you know as a dentist and how do you apply it today, looking at the 21st century, the century of the time of technology. How did you take and how do you actually integrate that which you learned from undergrad, apply it in your practice or apply it in a government institution to where you are now, and what is it that you're looking forward to? Where do you see yourself in the next years? Are you still going to be using the old way to be doing the old technique of file in the finger as you do your root canals, or you're gonna move from the motor state to go and start applying technology using rotary instruments? And when you use those instruments, by the way, you have to know that they've been actually manufactured by technologists as well as dentists who knew what functions those are supposed to carry. Because if you don't know white winding, how are you going to do reciprocation? So my topic is to actually take you from the old way of doing things to the new way of doing things, with the purpose of being efficient and actually making sure that whenever you do you carry an endodontic treatment, you are sure of between 80 and 90, just as a thumb sucking number, 97% success rate. Unlike previously, where when you do an endodontic treatment, you just put everything and say, God, take over. I don't know what will happen. and you wait for the time where the patient comes back to you and he or she says that that work which you did, it's failing. And by the way, I'm glad that this evening I'm with a Prof because he can always attest to this. When we do endodontics, we actually invade enamel, we go into dentin, and sometimes we use materials that needs to adhere to both dentin and enamel. And if you don't know what material you're using, you can do the most beautiful endodontic treatment only for you to fail at the end because you won't have that which he's going to talk about, the coronal seal. Yeah. In short, that's what they should expect, from me at Avianto.
Thank you so much, Dr. Sibuyi. I'd like to just rope Prof in, and basically speak to the fact that, we're looking at the conference and it's upcoming, and how then does his topic, what are the key points that the audience can take home, and those that haven't registered, why should they register?
Yeah, thank you, Sepang. And I think what Dr. Sibuyi is alluding to, the fact that you have your foundation coming from university, that is your foundation to build on. So coming to CPD events like the Samiri Weekend Breakaway, you can take that foundation and the basics that you've learned, and you now need to build that house or that palace, depending on how large your aspirations are, on that foundation that you have learned. You cannot go out with that knowledge and think that you can now practice that final year dentistry for the next 20 years, because you will then always stay on the level of a final year student. You have to go out, educate yourself, come to these types of CPD events and learn from colleagues and peers, because we are all peers, and identify, this is the type of lecturer or the type of conference I would like to be associated with because it's evidence-based. It really goes down to how the materials work, how the procedures work, what the success rates are, and it's all founded in science and evidence. So what the delegates can expect is a really well-rounded program, all of the lectures, evidence-based, well-rounded in science, and then those takeaway home messages. Yes, you've been using certain materials. Have you been using it correctly? What has come into the market of late? Is there any differences? How do they compare with one another? What does the latest literature say? What is our own research that we've done here in South Africa? We don't always have to look at international research. We do a lot of very, very good and accurate research in South Africa. We're going to show you some of those things, some of our masters and our PhD students and our own research, so you can really see the types of things we are doing here at the southern tip of our continent. So those take-home messages will be able to go from Dr. Sibuyi's lectures, where you're going from the apex all the way to the CEJ, and then we're going to do that dentin replacement, have a look at all your material options, how exactly they operate, how good that dentin seal is going to be, because that also protects your apical root canal that you spend so many, many hours on getting to the perfect working length and that patency. On top of that dentin replacement, which there are many options of, and we're going to discuss all of them in detail. We're even going to have a hands-on on how to do that dentin replacement, but also your cuspal rebuild, because the tooth needs strength, it needs anatomy and structure. And those are the types of things where we now go over to our workshops, where we get those hands-on training, so that you can really get a full, well-rounded conference, all the way from theoretical to the practical component. And we have quite a few workshops in store. So it's going to be a packed weekend.
Oh, beautiful. Dr. Sibuyi, your
Yes.
topic is The Future is Here. Tell us more, mastering the techniques of modern root canal therapy approach. I wanna hear more about the future.
The future is here. Indeed, the future is here. You have to understand that you can actually do a root canal treatment on a root, yet you cannot restore that tooth. So, firstly, you need to have a proper diagnosis. And how do you do a diagnosis if you don't have proper equipment or equipment that are advanced to be able to tell you the state of the tooth that you're going to work on? And most importantly, It is not about the tooth, it's about the patient that you are treating. So we're not focusing on the AI or our diagnostic material without looking at the patient's needs as well as the tooth needs. So when we say the future is here, is that the patient becomes part of the treatment. And when the patient becomes part of the treatment, it is based on whether the patient understands what is it that you want, or what is it that you are doing in his oral cavity. I always give an example with, when you take your car to service and you leave it there, you are in the dark. Somebody calls you to say, now your brake pads are 50%, 80%. I mean, you haven't seen anything. So these days, the patient becomes part of it. There's Google. There's a lot of information out there. So you sit down with the patient, you discuss the treatment while the patient can see and understand what is it that you are doing in his oral cavity. Because at the end of the day, they will tell you, but I did a root canal so many years ago, and it only lasted for 3 weeks, for a few months, and it's gone. Are you really going to make sure that this is going to last for long? That I have to reassure you as a patient and show you evidence. That is why Prof was speaking of evidence-based, research, evidence-based procedures. So if I show you evidence that this really works, and there are materials that have been made specifically to make sure that this success, this come to to actually you can stay longer with your own tooth, while at the same time we need to let our patients know the other treatment modalities that are available. We don't have to hide anything, but most of all, we have to tell the patient that you can keep your tooth as long as possible, and it is possible because of what we have nowadays. The technology actually it's more advanced. So while I'm speaking about technology, the way we're doing root canals, where you are told you can do crown down technique, you can do step back and all that. I want to tell you something. In dentistry, what I've seen lately is that everybody that has a treatment technique that he comes with, he gives it a name. And I found, I don't know about you, Prof, at training institution, where you have to ask the student a question, and that question has to do with a name of a procedure. I find it difficult because I think I should ask a question that is based on application. And you say that, how would you solve such a case? And what movement would you do if you're using a file? This crown down, step back and all that. You can just tell students to understand it. But I'll give an example. There's an example of, they say it's a zone technique. And zone technique is just a crown down technique. You divide your root into 3. So this is basically what we are saying. People should get themselves updated with what is happening nowadays. So the future is here, and the future is understand more of what you are doing with what you are having. Thank
Beautiful. I love it. Dr. Sibuyi and Professor Rian Mulder, I am about to, get into other things now. Please allow me. I'm getting more personal now. It's getting on a personal level. So besides dentistry, what do you do as a form of relaxation when you're not doing dentistry? What is it that you do? Because a lot of times we look at doctors, and professionals, dental professionals and clinicians, and we see you as, these serious guys that are always working in scrubs, you know what I mean? So I think tonight offers us an opportunity to get to know you a little bit better. Prof, let's start with you.
Excellent. Thank you very much. So when we are not working, my wife and I enjoys hiking. So living in the Western Cape, we are very fortunate to have an extreme amount of hiking trails, whether it is towards Table Mountain or you go towards Franschhoek or Paul. There are just so many to choose from. So that is one of our favorite pastimes. If it's a little bit on the chilly side or the wind is quite a bit strong, then we would then run in our area. So we are not comrades runners. but we can at least do something between 5 and 10 kilometers, so that's not too bad. I'm also a keen archer. So, when it comes to precision and research and making sure everything just is perfect according to methodology, archery really fits into that type of narrative for me, because I know where that bullseye is. And it takes practice to get to that point. So, what they use in the Olympics is called a recurve archery. So that is where you don't have foils and things assisting you in actually pulling back. It's your own human strength. So you have to build your strength as well based on the lever arms and everything. So that is something that I do enjoy. And then we have our little dogs that we also go and walk and train. So those are the things that we spend our pastime with. And then of course I do like my series. So I don't miss a chance to watch a couple of seasons of series on a weekend. I don't mind that type of relaxation either.
Oh, that's beautiful. It is a getaway, and I think a lot of people are going to be pleased to meet you not only as a professional, but as a human being. You know what I mean? Dr. Sibuyi, what do you do for relaxation?
I just saw something posted on they say I probably like rapping. I cannot do that. Okay, and let me openly say that the difference between me and Prof is that they can call him Prof, and with me it's professori. It remains professori. So he's the real professor. And the difference between me and you, Prof, is that you like hiking. I've done hiking just a few times, but there was a times where I wanted to, to make a U-turn on my way up the mountains.
No, absolutely.
There are quite a lot of places where you can do hiking in my area, but really, I'm not a rapper. I forgot the name of the doctor that wrote. I'm a saxophone player.
Dr. Dre is the rapper, right?
I play a saxophone. I play both tenor and alto saxophone, but tenor is the same as the soprano, so sometimes I have to move between the two, and that's what I do in church. And when I'm alone, lucky enough for me, you can't see where I'm seated, but there's a keyboard next to me and some studio equipment next to me. So that's what I like doing. I like singing as well. In church, I actually have a lot of gospel artists who are friends with, whom I'm friends with, and yeah, I just love the Lord. That's what I can say. And one other thing, you can't be staying next to the Kruger National Park and don't like taking pictures. I like photography. I like, when I go there, I don't go there to see animals. I'm going there to take pictures of the animals. And I've got so many pictures that are just lying around. My children used to say that, but you got beautiful pictures. Why don't you sell these things? People can frame them and do. But I said, I'm only doing it for myself, not for any other person. So yeah, those are two things that I do. At my age, I'm not mentioning it, I still do play soccer, where it's only above a certain age. So if you are below that, you're not allowed to be in a lineup. So I still do that, though it's limited. I had a problem with my rotator cuff muscle where they said they have to operate, and I was told I have to stay 6 weeks without working. Then I said, no ways, I'll recover. So, yeah, that's basically who I am. I do that. Besides looking at dentine and the pulp, yeah, that's what I do.
Oh,
thank you.
Two very interesting individuals. I love this so much. Thank you so much for giving me a sneak peek into your personal life. I really appreciate it. So now I would like to talk about how now in your professional, careers, how you've obviously, came across a lot of challenges here and there. So I just want to find out what kept you going this far, and what would you say? I think Prof touched on, what he would tell to the young professionals that are coming into dentistry and also will be at the conference. maybe Dr. Sibuyi, you can speak on that as well. So just let us know what are the challenges that you've, encountered and what really kept you going. Prof?
Yeah, so look, dentistry is not easy. Dentistry is a hard discipline. It's a hard job. Every single patient, every single tooth is different. So when you get faced with those clinical scenarios and you see the second and the third one, and you just say, you know what, something's not working well, it's just not perfect. And just at that point where you think, it's good enough. Let's just leave it there. It's good enough. That is the point where I tell myself, no, we will go down to the research laboratory. We will simulate this in the lab and we will make it good enough. And then we will go past that point and then we'll make it perfect. So that is really what keeps me going, is my research and creating that perfect seal between the tooth and the restoration. Because the reality is we cannot replace and create the tooth the way that it was originally designed. So we can only do what the materials allow us to do. And that is where our hands come in to try and achieve that. And that is where my research is also focused. So we use quite advanced techniques in order to do some assessments and computer simulations and micro CT scanning in order to see how does the tooth and the restoration and everything interact with one another and how can we use that and translate it into the clinical guide in order to make us as clinicians better and creating that perfect restoration or that perfect endodontic treatment for our patients. So that's really what keeps me going is, just trying to create that perfection as close as possible to what the original tooth was, which I don't think we'll be able to get to, but we have to try.
Prof, with that being said, can I please just have a minute to say this? If you are a clinician, a dental professional, and you have not registered for the Omeri 2026 conference, please go to www.omeri.co.za and get yourself a ticket, get yourself registered, because it's been a few minutes into this session and you can already hear that Prof and Dr. Sibuyi are quite insightful, and this is just surface level information. Now, imagine if you're at the conference and you're getting into these hands-on workshops as well, and you're getting more insight, you will really be taking time to invest into yourself. So please, not only yourself and also your practice as well. So please, ladies and gentlemen, let's go. Dr. Sibuyi, please let us know about the challenges that you've also faced and honestly what kept you going so far.
Yeah, I'll be open about it as well. There are so many challenges in dentistry and they have affected me. The worst was in 2011, where it affected me in such a way that I thought dentistry is not it. I want to move on to something else. And the reason that was happening is because I kept everything to myself. I worked in isolation. You are in your private practice, attending very few courses. But I will be open with this as well, because the then training was not as good and as open as it is today. Prof, you'll attest to this, that we used to attend. I'll give an example. Maybe I shouldn't say this, but I'll give an example where a specialist will just give a little bit of what is exactly happening and keep the information, for the specialist and not say. But nowadays, there's nothing that is hidden. Everything it's, the ground is leveled in such a way that information that you need, you can get from anywhere. But the application is the key. So in 2011, I really wanted to give up, and hence I just to go back a little bit, my wife came with books, and she used to ask me about economics and accounting because she was doing an MBA. I didn't have answers to what she was asking me, and I got frustrated, So I decided just one day, when she has given up that she's now carrying on with an MBA, I went and enrolled in secret. And she saw me one day with the study material, holding them, getting into the house with the study material. And I said, I'm enrolled, for MBA. And that's when we started discussing economics, project management and all those MBA courses. And now with accounting, we started discussing. It was something that I understand. So I thought this is this is a place where I never thought I would go, because I never did accounting at school. And even stats actually gave me a little bit of a 5-point correction, a slap. No, I failed as I was doing MBA, but I wrote a supplementary exam. That's when I said, mathematics, you have to sit there, and now I'm doing stats. That's when I, passed my first year of MBA. But the reason I did MBA was that I knew that dentistry can make it's a successful career. But if you don't know how to manage your finances, you're just working from hand to mouth. And the other disappointing issue is about the medical aids, third-party funders. Hence, my research, my MBA research was on the external environment that affects dentistry in South Africa. So that was my research. And after that, I knew that technology is part of dentistry. Hence, from one of our speakers who will be at Avianto as well, Dr. Mabunda, Mordecai, he influenced me into buying a CEREC machine. That machine made me to love dentistry once again, because I could do what the patient wants. I could show the patient how this tooth is manufactured. From there going forth, technology became part of my practice. Technology became part of me. Hence, at the present moment, we're busy with 3D printing. I can tell you, anything that I see, I know that once I can scan it, I will print it. I remember this day, the patient was taking a Panorex, and just where they bite, I think it's the bite, quickly, when you say bite, the patient will go full force and break that, it's like a plate, beat it off. But I just put it together, scanned it, and I had an STL, printed it through my 3D printer, put it back, and I can use. Now I've got more than 5 of those things. So, dentistry is interesting lately. Just to add more, when you extract a tooth in your practice, that doesn't belong to a rubbish bin. That is something that you can use as a postmortem of what has been done in that tooth, if there was an endodontic treatment in it. I always make sure that the teeth that I extract, some of them, and actually the most difficult ones, cavity roots, I keep them in hydrogen peroxide. It will be clean. It won't smell. I go back to them, open the access cavity, work on them. That's how I managed to fine-tune my skills in endodontics. Apex locators. I never use an apex locator which I haven't tested myself and see if it works perfectly. There were apex locators where we were told that this apex locator will work in wet canals, will work in dry canals and everything. I personally took liquids, mix them, put acrylic into water, and make sure that the electrodes go into that. And I saw electric current flowing. Then I knew that, no matter what, this apex locator, I'm going to use it in this way. Even if there is something written in their manual, I have my own way of using them. So that's how I work. Even lately, I've got the chip printer and the meat, the meat printer. Unlike Dr. Tadi, he's got the higher printer, but I've got those. So the chip printer made me know how the top of the range printers function. And so that's how I go about exploring dentistry and how it works. Thank you.
That is beautiful. Thank you so much, Dr. Sibuyi. And I love the fact that from both you and Prof, what has been, key in what you've been talking about this far is research, and that's what is continuing to make dentistry very interesting for you. I just quickly want to go to our chat and have a look. We had Dr. Nkumeleni here saying that you guys have beautiful stories and well done, and also saying that staying in your practice and missing this conference will keep you behind time to upskill. So ladies and gentlemen, please do the right thing. Go and register. We are looking forward to seeing you at the conference. I'd like to invite a few, like 5 questions in the chat, either in the Q&A or the webinar chat. Feel free. While we do that, I'd just like to go to our last questions that I'm going to be asking our speakers, which is basically, what should the delegates expect from the upcoming conference? Basically, just your final words about the conference.
Dr. Sibuyi?
Oh, okay.
Yes,
I'll
you
go
go.
first.
As the director, let's
Okay.
do it.
First, let me say that I like the environment where we are going to. I've been there. I saw how it is. I saw the breakaway rooms. So it is actually family friendly place, and I just like the ambience, in that in that place. There's a river flowing next to where we will be having our congress. I like nature, and really, if you think of a congress that is going to have both theoretical and practical work combined together, I would go for this one. Like I've said, I've attended congresses. I can give an example where I will go there, stay from 7 a.m. up till 6 p.m. And it's only theory, and it's only about how I did this. I started here, I ended here. It's not about this is the steps that you take to reach to the final product. So this congress is a congress that is going to equip you from start to finish. In an actual fact, I spoke about project management. I'll give an example. Endodontics is like project management. It's a project in itself. You see the end, you have the end in mind. You must actually diagnose where you begin, and the end, it's where the patient is going to function with that tooth that you have saved. So this congress is going to take you from the beginning up to the end. So you will have, in fact, what we're going to prepare for you is that the following day, if possible, just after the congress, you should be able to go and apply what will be dishing out at the congress in your practice, in the hospital that you are working in. So if you didn't register, I still remember it. It's www.omeri.co.za.
Perfect. Thank you very much, Dr. Sibuyi and Professor Mulder, for sharing your insights and experience with us. We truly look forward to your contributions at the upcoming Omeri conference. Now, to formally conclude this evening, I now would like to just invite Dr. Mandla Jobela to just, deliver a vote of thanks. Thank you very much, gentlemen.
Everyone. We all are in to say that evening and one. But I would first to thank our Omeri executive. I'd like to thank the speakers, Prof. Mulder. Now you know why we call our Dr. Isaac Sibuyi Professor, that he's the one who started, ago, and she was going on inside the tooth. Say something to you, Prof. You make professorship cool, You belong here. There's a term that we use. We call it Omerified. You are part of us now. There's no going anywhere. I would like the LOC, which I'm part of. I'm the deputy there, especially mentioning my occasion, especially that it always is, with Omeri. Riley Digital, you're doing amazing. We appreciate you. You are also not going anywhere. Anything we do and moving forward, we're moving with you. We're so proud of you. Last but not least, the delegates. That's the people who make the conference, if you're watching us from wherever you are, now I know you will do the right thing. Those who have already registered, you will not blame yourself for making the right decision. Trust me, I've been to Avianto a couple of times for weddings. You'll just fall in love with the place. There is no reason for not being there on the 20th and the 21st of March. We just cannot wait. Switch for change, the next level in dentistry. It's the buzzword. It's the buzzword. So let's all make sure that we don't change our minds for any reason. We just be there. Thank you very much. I'd like to get back to Tsepang, who will proceed with the closure for tonight. Thank you very much. It was a lovely, lovely evening. Thank you.
Thank you so much, Dr. Jovela. Truly, truly appreciate it. So, ladies and gentlemen, I would like to take this moment to say that we see you and we truly appreciate you for taking this time to joining us and being in this live with us this evening. I believe your time was not wasted and that you enjoyed each and every minute of this live session. Thank you once again to our speakers, sponsors, partners, and everyone who joined this evening. We look forward to welcoming you at the Omeri 2026 conference as we continue to shape the future of dentistry together. Ladies and gentlemen, have a wonderful evening, and thank you so much for being part of the Omeri community. See you soon.
Thank you.
Yo, there was a pathway. Yay, I had to read their CVs. Oh my goodness. I don't know what is happening. I was so nervous. Like, it is what it is. Hey, D, this was online. Like, we are all online. I'm sitting at my desk.
Hello, everybody, dentists everywhere around South Africa and the neighboring countries. We are at Avianto.
Expect nothing short of exciting lectures, ambience everywhere, exquisiteness in terms of the venue, breathtaking views, lovely people that you'll be interacting with as usual, and definitely we're going to make Omeri 2026 very epic, something you've never experienced before.
Register now for our early bird special. Don't miss it because you'll be saving a lot of money. Late registrations is going to be too costly for you. Don't wait until that time. My advice for you, register now.
We are going to deliver the greatest program of all time. in terms of innovation, in terms of technology. Just trying to show you how we can incorporate all these new technologies into your practice.
The place is amazing, and we look forward to see each and every one of you that is doing the 21 Jam March 2026. See you there.
Dr. Tari,
Dr. Eric.
Can we end this and rejoin for the debriefing? A short one.
Just hold on.
Yeah. Or you can create a link and send for the short debriefing. Yeah, Prof doesn't have to be there. It's only the LOC, Exco, and Rally Digital. Ratzat, are you there?
Yeah, no. Let me just remove the appendix and you can continue. Yeah.
You can. Oh, okay, no, it's fine. Thank you, Catherine, Dr. Dibakwan, for joining in. Dr. George Tubahale, we see you. Karabo, we see you guys. Thank you so much. Dr. Chris Houston, we see you. And Kennedy, we see you. Lebahang Malunga, Dr. Lebahang, we see you guys. Thank you so much.